We are back with more ideas on home safety for elderly parents, more tips to help you build those relevant steps to have conversations with your elderly parents so that they participate with you in care. In this webinar, we are going to talk about reasons that elderly parents fall that you may not think about. So let's start with the usual part, the housekeeping instructions. I use the term elderly parent or parents for the person for whom you provide care. Print out the outline in the module, the slide handouts in the module, fill in the blanks, stay with me as we go through this program. So let's talk about the objectives of reasons that elderly parents fall. At the end of this part, you should be able to recognize common diseases that increase the likelihood of falls for the elderly, have another source of relevant information. So more reasons, because sometimes you have to maybe go back 20 times to support discussions about health prevention with elderly parents. So in all of these webinars, I continually give you more fuel for the fire, more reasons to go back to say, oh, mom or dad, here's another reason why you should do this. A lot of caregivers will ask the question, are chronic diseases heritable? Means, can I inherit this from my parents? I want to start this section by saying that having chronic diseases like heart disease, diabetes, obesity, high blood pressure relate more to lifestyle choices, the choices that you make in life rather than hereditary. This information might be good news. If you have family members with chronic diseases, you might be thinking, oh, thank God, I can do something. I can avoid that. Or it may be shocking if you have high blood pressure or another chronic disease and you want to blame that on family history. Can't do that. 80% of that is up to you. According to research, there are some diseases that do have a greater connection to genetics. However, most diseases have less than a 20% chance of being inherited. Being proactive about health may not be a cultural norm. It may not have been shared within your families. It definitely is not a consistent public conversation, but now you're in a place where, at least during this webinar, you have consistent education about the benefits of health prevention and physical activity that really is missed in primary and secondary schools. That lack of knowledge, when we're young, if we don't get it from our families, we don't get it from school, results in low participation by consumers to take steps to be proactive about health. And while the healthcare system does talk about healthy behaviors, if we don't know what that means, what motivation do we have to engage in healthy behaviors? Doctors and medical providers are time limited. Health insurance companies pay to diagnose disease and treat, but they don't pay for doctors to talk to you about health prevention. Health and well-being are a consumer responsibility. Lifestyle actions are the key for us to future good or bad health. It is totally up to us. I found some interesting wisdom about health, and I want to start with one from Hippocrates, born 460 BC. So this is not new information. Even back then, researchers knew about chronic disease and exercise. These statements I'm going to read to you, they've been around for more than 2,000 years. And they still have not prevented people as early as age 40 from having chronic disease. So use some of these for your elderly parents. So the first one from Hippocrates says, if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. If there is any deficiency in food and exercise, the body will fall sick. And my favorite on this slide, walking is man's best medicine. Then we come through research to today. So here's a quote by Frank Booth. It says, poor lifestyle choices such as smoking, overuse of alcohol, poor diet, lack of physical activity, and inadequate relief of chronic stress, caregiving stress being one of those, are key contributors in the development and progression of preventable chronic diseases. Notice the word preventable. Then we have the Cleveland Clinic. This quote is on the slide. While exercise is a treatment to prevent many chronic diseases, it is the lack of regular exercise or physical inactivity that is one of the actual causes of many of these diseases. So how are we doing here? Do you know now more about health prevention than you did before this program? Are you more likely to take action to prevent chronic disease and to talk to your elderly parents about steps to feel better every day? So let's take a step forward. I want to review some health conditions. These are not all inclusive, but very common ones that contribute to falls that your parents may be experiencing that you may not have talked to doctors about. The first one is dizziness, vertigo, positional vertigo, or Meniere's disease. These are all related to imbalances in the air or related to a chronic disease. Dizziness and poor balance are very common in the elderly. We've talked about balance being related to weak physical strength and low amounts of physical activity, but it also could be an inner ear. Statistics indicate that 24% of people older than age 72 experience dizziness. The terms are on this slide, and there's one of them. So one is called benign paroxysmal positional vertigo. It's abbreviated B like boy, Paul Paul, BPP. That happens as early as in childhood, but more commonly begins around the age of 60 for all adults. So how do you know if you have this? Trust me, you will know. You will see the world spinning in a circular motion in front of you. Even in a lying down position, looking forward or with your head tilted to one side or another, you might feel like the world is spinning. If you turn from side to side in bed, that can initiate a sense of spinning. Any type of change in the position of the body and the head can lead to this experience of being dizzy. And I liken it to, I don't know how many of you have ever had the spins from having a little too much to drink. I'm sure none of you. But if you have, that's what BPP is like. Add to it that nausea and vomiting can accompany the dizzy episodes, and the episodes can come and go. There are medications for the nausea that can be prescribed, motion sickness medications like Bonine. It's the same as meclizine. It's an over-the-counter supplement that helps with motion sickness. But the cause of this dizziness, and you have to get this diagnosed by an ear, nose, throat physician, is that crystals in the ear become loose, and that makes the head more sensitive to any change in position. If you make an appointment with your ear, nose, and throat doctor, they can do a special test to tell you if you have BPP or normal vertigo or Meniere's disease, or maybe it's something else. But there are exercises, so more exercises, right? Exercises can manage the BPP vertigo that really have shown great success, but you have to, again, perform those consistently. Meniere's disease is a balance disorder that affects the ear. That can cause progressive deafness. It can cause ringing in the ears and also being dizzy. And there's also medications for that. So for any of these, go see an ear, nose, and throat doctor and have them investigated. Don't just suffer with them. Then we have low vision and hearing loss. Low vision and hearing loss can result in falls. Vision concerns like farsightedness, nearsightedness, cataracts, macular degeneration, and glaucoma can cause falls. Regular vision appointments, meaning once every year, are essential to identifying vision concerns that can be managed by wearing glasses, contact lenses, or other types of treatments. There's a study out there by Johns Hopkins School of Medicine. It confirms a link between hearing loss and falls among older adults. The greater the hearing loss in decibels, the higher risk of falling. It's kind of like the crystals in our ears when they become loose because of BPP make our head more sensitive to motion. When we lose the ability to hear, we can lose the ability to sense that we're getting close to a wall because of the way steps sound. So hearing loss in other studies is also associated with an increased likelihood of a diagnosis of dementia. Again, ear, nose, and throat specialist, they are also audiologists. They can do hearing evaluations and make sure that none of these are the issue. Another common issue is a drop attack. It's medical speak for a sudden fall to the ground when an elderly parent doesn't black out. The average attack at which drop attacks begin is between 45 and 55, so relatively young. A neurological symptom is that suspect, but drop attacks may also be caused by heart conditions, epilepsy, hip or knee instabilities. If you watch a drop attack, you just see somebody fall to the ground. For people who have these drop attacks, they can have fear of going outside because they are worried about having a drop attack in public. In older people, drop attacks are sometimes called syncope, which is the next subject. If you're experiencing these, a specialty appointment with a cardiologist or a neurologist is your next best step. Let's talk about other reasons for fainting or passing out. Syncope is that term for fainting or passing out. According to the Cleveland Clinic, syncope is caused by a temporary drop in the amount of blood that flows to the brain. It's more common among people who are 75 and older and affects about 6% of this age group. So drop attacks are younger, start at 45 to 55, syncope older, age 75 or greater. Also, if you've ever become dizzy when standing from a seated position, you may have experienced vasovagal syncope. Standing and sudden changes in position result in this momentary dizziness. Vasovagal syncope can also be caused by dehydration, anxiety, fear, pain, and other daily activities. There's another term called orthostatic hypotension. It's also called postural hypotension. This is medical speak for a sudden drop in blood pressure from standing up after sitting or lying down. The feeling experienced is lightheadedness, weakness, blurred vision, or passing out. Being dehydrated is one cause of postural hypertension. Syncope, vasovagal syncope, and orthostatic hypotension are conditions best investigated with your cardiologist or a neurologist. If you have to ask for a specialist referral, do so. Falls in the elderly, besides being the result of weakness, can be the result of infections like a urinary tract infection. Infections resulting in physical weakness and falls include urinary tract infections, bacteremia, respiratory tract infections like pneumonia, the seasonal flu, the coronavirus, and sepsis. Many of these conditions in my clients were identified by reports of lightheadedness, dizziness, disorientation, or having a rapid change in condition. Taking a temperature, blood pressure, oxygen levels are another way to identify if an infection is brewing. If your parent has multiple chronic conditions, it really is a good idea to have a thermometer, a blood pressure monitor, and a pulse oxygen reader in the home so that you can know what normal measures are and know what measures are when there is an infection. Urinary tract infections are more common in people with memory loss. Other common reasons for urinary tract infections are dehydration and poor hygiene, so not being clean down there, results in being incontinent. Wearing depends that are not changed frequently can result in urinary tract infections. And the problem with dementia is that if a person has a urinary tract infection, they can't tell you. You notice by agitation, odd behaviors, restlessness, hallucinations, all of a sudden they're tired, or having a very strong smell of urine, a temperature, a fever. The tip to catching all of these infections before they result in something more serious is to be very observant of typical behaviors of elderly parents and any change in condition. So let's just summarize this. A lot of conditions contribute to falls in the elderly. Some of them are chronic diseases. Some of them are health conditions that you might not have thought about, that you should be seeing a specialist about to manage. Our goal is to become more aware of all of these common conditions in elderly so that we can be preventative rather than responding after a condition happens. I'm Pamela D Wilson. Thank you for joining me for this webinar. I look forward to the next webinar with you. Check out again past webinars, read through your notes, check out the outlines, check out your slide presentations, all of this information. It's going to come in handy sooner or later as a caregiver. I'll see you in the next webinar.